Good morning, everyone. Thank you for joining us for our February presentation in the 5th year of our speaker series, Toxicology and Societies, the Impacts of Chemicals in Our Lives. I'm Ruth Sofield, a professor of environmental toxicology and chemistry at Western Washington University, and I'm joined by my co-host, Ian Moran.
Hi, Ruth.
Hi, Ian. How you doing?
Good.
And our other co-host, Tracy Collier, who could not be here today. Oh, so I'm actually not joined by him. He's not here today. Hi, Tracy, wherever you are. So we would like to begin by acknowledging that we at Western Washington University are on the ancestral homelands of the Coast Salish peoples who have lived in the Salish Sea Basin throughout the San Juan Islands and North Cascades watershed from time immemorial. Please join us in expressing our deepest respect and gratitude for our Indigenous neighbors, the Lummi Nation and Nooksack tribe, for their enduring care and protection of our shared lands and waterways. And now I'd like to go over a few logistics. We will save questions for you until the end of the presentation, but you can use the Q&A feature on your screen at any time. You will be muted throughout the presentation, so we will use this feature to interact. The focus of our speaker series is to provide understandable examples of how events with a toxicological component have consequences to people and societies. Today, we are delighted to welcome Janae Colton and Jennifer Lanksberry of the Toxicology and Containment Assessment Unit in King County. I learned about their work with immigrant and refugee communities at a recent workshop and was really excited to be able to share this great example of how working together with communities improves our science and the outcomes associated with it. Welcome, Janae and Jennifer.
Thank you, Ruth. Thanks so much. It's wonderful to be here today, and thank you for inviting us. Thank you all for joining. Jennifer and I work in the Water and Land Resources Division of King County in the science section. I supervise a group of ecotoxicologists who help natural resource and utility managers understand and treat toxic chemicals. Jennifer is a toxicologist in that group and supports our freshwater and marine toxics monitoring programs. Today, she and I will be talking about the evolution and outcomes of a 3-year collaborative research project on toxics in fish and crab. This project came about thanks to the curiosity and commitment of many individuals across various organizations. This was our team's first time with this sort of intentional, long-term community engagement project. So we're excited to share the process and our key takeaways in the hopes that it could inspire more work like this to occur across King County. Next slide, Jen. In our unit of the science section, we have freshwater and marine monitoring programs that regularly measure toxic contaminants in select fish and shellfish species. Our program data have been used to determine if species are safe or not safe by Washington's Department of Health. But prior to this project, we had little specific information on where King County fishers like to fish and for what. So we consulted other experts and made a lot of assumptions, some of which we have learned are incorrect. I was asked to start up the Marine Toxics Monitoring Program in 2014. Early in the program, I remember consulting Public Health of Seattle, King County, and Washington Department of Health to see if there was any King County Fisher Survey data beyond the Lower Duwamish survey, which was completed for the Superfund site. The answer was that there was almost nothing, especially that was not solely targeting English speakers. King County was also limited in what species we could target due to a limitation in various fishing equipment that we had. So any new ways to obtain fish as samples would be helpful. I learned during these conversations with public health that their work with a nonprofit on the Lower Duwamish survey enabled them to gain extremely valuable insight into marginalized communities of fishers who don't speak English or English as their second language. Public health was just as interested as we were in getting better information on where people fish and what they eat. We vowed to collaborate to reach this goal if an opportunity arose. And in 2021, that opportunity came. That opened the door for us to begin a partnership with Refugee Federation Service Center, or the RFSC. They are an organization located in Kent that assists immigrants and refugees as they transition to life in the US. This organization has a special interest in environmental justice and education, and had a strong working relationship with public health from their partnership on the Lower Duwamish Waterways Fisher Survey. Next. We built our relationship with the RFSC via affiliation with their partner, Public Health, and by offering in-kind services to enhance their outreach project on water quality. After discussing our goals and realizing several mutual benefits to partnering, we worked with them to develop a successful application for a Waterworks grant from King County's Wastewater Treatment Division. With the grant awarded, RFSC was funded to work on this project with us, and we started working as a team, building trust and establishing our own working relationship. Jennifer started working on this project once the grant was in hand, and has driven this project forward by leading coordination with the Refugee Federation on the survey, fish sample transfer, and developing the flyer. So I'll turn the rest of the presentation over to her. But I also want to credit first Richard Jack and Chelsea Mitchell, who have been integral members of our team at King County. Jennifer?
Okay, thank you, Janae, appreciate it. So marginalized communities are often told what not to do, where not to go, and what not to eat. Early on in our work with the Refugee Federation Service Center, RFSC, they told us that the immigrant and refugee community fishers are also interested in hearing about the things they can do, like where are the safer places to fish and which types of fish are safest to feed their families. To get a better understanding of their existing fishing practices, we put together, with the help of the RFSC, a fisher survey that the RFSC administered throughout their communities in 2022. The fisher survey showed us where fishers from these communities go to fish, what they're catching, what parts of the fish or shellfish they eat, whom they share their catch with, and how much they consume. We analyzed the fisher survey data and pinpointed some popular fishing areas and fish species targeted by these communities that are not part of our regular long-term tissue monitoring program. We used that information to design a collaborative pilot fish sampling project that could fill some gaps in our program and give us meaningful data to report back to those fishing communities. For this project, fishers from the King County immigrant and refugee communities did the actual fishing. Importantly, as part of the grant funding agreement, the RFSC paid them in exchange for their efforts. To kick off the pilot fishing project, in 2023, we hosted a multilingual fisher training workshop to show the fishers where we needed them to fish, which fish to target, and to instruct them on how to properly handle fish meant for chemical analysis. The fishers then spent the spring, summer, and fall of 2023 fishing at new lakes and saltwater shorelines in King County that are not currently part of our long-term fish monitoring program. At the end of the fishing, our King County Environmental Lab tested the fish samples for chemicals, and then our team began analyzing the data and preparing to share our findings. And then we hit a snag. Things up to this point had been running smoothly, but now that we were ready to share the project findings and our recommendations about which fish to eat and in what quantities, we had some things to figure out. Now, the Washington State Department of Health has the authority to issue fish advisories, to communicate those advisories, and then to put up signage around Puget Sound's fishing areas. The role of public health of Seattle and King County is to communicate public health guidance to local fishers with approval from the Washington Department of Health. But our group, our team at King County, doesn't really have authority to issue public advisories. And we had never before tried to communicate public health information in such a direct way to fishers. So we had to untangle roles and understand our limitations, like what is our duty or obligation here for this project, compared to the Department of Health or to public health. And so that took a little bit of time. We also hit a snag as we attempted to design our recommendations flyer and have it translated into 9 different languages. We had worked before with our graphics unit here at King County on posters and other projects, but we had never needed anything translated, and it was unclear to us how to manage the design work and the translations together. After some initial confusion, Public Health's translation team did a wonderful job with the translations, and then a contractor that works with King County pulled together the translated text in each language into the final flyers. So here is a picture of our flyer. It's got two sides. It's going to transition to the other side in a minute. We printed it on 11 by 17 format paper, so it's quite large. And there's a freshwater and a saltwater side. As I said before, we had it translated from English into 9 languages. The terms and the phrasing on the flyer and its layout were largely informed by guidance from Public Health Seattle, King County, and Washington Department of Health, who'd worked on recommendations and advisories in the past. But we also had help from King County's communication and outreach experts, and importantly, we had input from the RFSC staff as well. It was actually the RFSC who encouraged us to use a large format for the flyer, and they reviewed our early efforts to help ensure it would be usable and make sense to the community fishers. Also very helpful was guidance from a program called Foundations of Data Equity, which our section is learning from as part of King County's Equity and Social Justice Initiative. Their program includes several content, medium, and access checklists that further helped us improve the flyer from an equity perspective. So in September of 2022, and this video doesn't have any sound, so don't worry if you can't hear, we came back together with the RFSC, the fishers and their families, and local leaders from their communities for a presentation at the Duwamish Community Hub in Seattle, where we shared our findings and recommendations, including hard copies of the flyers, and acknowledged their efforts in the research. For this meeting, the RFSC had 5 interpreters who translated our presentation simultaneously to about 45 attendees of all ages. Now, the fish and fishing are key to the diets and cultures of many people that were in that room. And so they were very engaged and eager to hear what we had to say, to learn how our data could help them make safer choices for themselves and their families, and how it might influence the health of others in their communities. After our presentation, we answered questions, we heard additional community needs, and discussed ideas for how we can work together to distribute the recommendations even more broadly. But we weren't done yet. During that meeting, we realized there was still more to do for this project. For example, during the question period, the fishers asked if we could give them a digital version of the flyers. We said that we had planned on posting the digital versions on our website, which we've since done, but they wanted us to send them the files sooner so they could share them on their own social media networks. As one of the fishers told us, nobody I know is looking at King County's website, but they all read what I post on Facebook. So that was pretty important. At the same time, we heard that physical copies are still very important to have available for people without phones or computers, people who can't read, and some older people. And we also heard that in-person gatherings like that community meeting are reliable and effective ways to reach folks who aren't on computers and cell phones also. And they really were happy that we were meeting with them in person. We have since, as I said, shared digital copies of the flyers with the RFSC and provided print copies in all 9 languages that they can share with their extended in-person networks. And we're excited to continue nurturing these relationships in the future, possibly through more community meetings or even new research projects. And I'm also glad to say that our section is also having the flyer translated, I think, into an additional 5 languages. So we're expanding the number of languages for the flyer. So what did we learn from this project? What were some of the key takeaways? Well, based on our experience, some of the key elements of success were transparency, reciprocity, and trust. There were a lot of people involved in this project, and everyone brought different things to the table, including funding, research expertise, data, community expertise, and access to existing networks and relationships. People in these communities are eager to work with us, to hear what the data has to say, and then to tell us how to make that data more meaningful and useful for them. For example, before this project, we assumed that fishers stay close to their residences to fish, but we learned from the communities, especially at this meeting, that they actually travel quite far for fishing opportunities all over the state. Sometimes they go in groups on buses to different fishing locations. We were also working under the assumption that most people eat fish fillets, not the whole fish. But we learned from the Fisher survey that folks from these communities are often cooking and eating the whole fish they catch, and that they also like to eat crab butter, the innards, the guts of the crab. This input helped us better craft our recommendations for the flyer too. For example, we included some explicit warnings about eating whole fish and crab guts, which tend to have more contaminants than just the meat. This project also highlighted the importance of leading with openness, adaptability, and a determination to solve problems. Some common blocks to progress are often things like money, capacity, chains of command, and leadership priorities. For this project, RFSC used the grant funding, and then we provided in-kind match via our existing program funding for staff time and sample analyses. Our leadership supported and modeled openness, adaptability, dedication to the public, and a willingness to experiment and find novel solutions. And I have to say their support made this work infinitely easier. Another takeaway is that it helps to start with existing relationships. King County staff have a lot of expertise and their own established relationships with tribes, local communities, volunteer groups, and nonprofit organizations. For this project, we built on some of those existing relationships, which made the project more fruitful and happen a lot faster. And finally, we believe community engagement is critical, not optional. When we started this project, we didn't know what the final product might look like or how it would get made or shared. We didn't have dedicated resources for all the different pieces or a community engagement guide to follow. But it was important to the community and important to us. And so we all worked together to make it happen. And we encourage researchers and people conducting studies to engage the communities that they are trying to serve. So that kind of concludes the part of our talk focused on the community engagement, but I wanted also to share in this some results from the Fisher survey and our chemical analyses of the fish. So we're going to start with the Fisher survey. As I mentioned earlier, we used data from the Fisher survey conducted as part of this project to learn about the fishing habits of the refugee and immigrant residents living in King County. The survey targeted fishers from West and Southwest Seattle and South King County residents living in White Center, Tukwila, Renton, Kent, and Auburn. To conduct the survey, the RFSC staff interviewed fishers at local community centers and at fishing locations. They translated the survey into 3 languages, Khmer, Vietnamese, and Spanish, and then did in-person interviews in 7 languages, including Burmese, Karen, Cham, Loshan, Khmu, Hmong, and Maine. So here is a chart showing the proportion of Fisher survey respondents by ethnicity. There were a total of 113 fishers interviewed for the survey. In the interviews, the fishers self-identified as coming from a wide range of ethnic communities, as you can see. The 2 largest groups identified as Vietnamese and Cambodian or Khmer. The next 3 largest groups were Latinos, Karen, and Khmu fishers. Several fishers identified themselves as American or Caucasian with English as their primary language, while others identified as Loshan, Chinese, Korean, Min, African American, and Burmese. So a large contingent of the population interviewed and respondents interviewed for this were people of Asian descent or Pacific Islander descent, as you can see. The survey asked fishers how often their household typically eats fish or shellfish caught by them or by someone they know. They were given 4 options for this response: that they never eat their catch, that they eat 1 to 4 meals per month, that they eat 8 to 12 meals per month, or more than 12 meals per month. 64% of the respondents reported eating 1 to 4 meals per month, while about a quarter said they ate about 8 to 12 meals per month. Less than 10% reported eating more than 12 meals per month. For a frame of reference here, the Washington Department of Health defines high fish consumers as people who eat 23 or more meals of fish per month. So based on this Fisher survey, these fishers and their families are typically not consuming fish they catch at those high consumer levels, though some small fraction may be consuming at those higher levels. The Fisher survey also asked which parts of the fish the fishers and their household commonly eat. The question included 4 choices with the option to check all that apply. So those were, are they eating the whole fish with the skin? Are they eating the fillet only with no skin, no head or organs? Are they eating the fish head, like in soups or other dishes? And then there was an other column that they could just fill in. Over half of the fishers included more than one of these options in their responses. So this graphic actually adds up to a more than 100% because there were multiple choices people filled in. But as you can see, 67% of the fishers reported eating fish fillets, and 61%, close to the same amount, reported eating the whole fish. 44% also reported eating the fish heads. So based on this information, it appears a large proportion of the King County immigrant and refugee community typically consumes the entire fish they catch. I'd like you to keep this information in mind when I show you some of our results from the fish tissue chemical analyses. I'm going to show that next. So let's talk about the chemical analysis of these fish. First, I want to tell you about the chemicals that we targeted for analysis. We were looking for polychlorinated biphenyls, or PCBs, and those were analyzed both as aerochlors and then homolog groups. We also looked for polybrominated diphenyl ethers, or PBDEs. Those are the flame retardant chemicals. We looked for several organochlorine pesticides. Those include DDTs, chlorines. Some of the other ones we looked at were benzene hexachlorides, or BHCs, heptachlors, and aldrin and endosulfan. We also looked for 2-per and polyfluoral alkyl substances, or PFAS chemicals. Specifically, those were PFOA, which is perfluorooctanoic acid, and PFAS, which is perfluorooctane sulfonic acid. We also analyzed for mercury as total mercury. And then here's kind of a complicated table. I'll walk you through it. This is all of the fish taken for this project that we had analyzed. As you can see on the far left column, the fish came from 4 lakes and 2 marine areas in King County. In the far right columns, you can see that we mostly analyzed composites of whole body fish. So that's several fish, whole fish put together and ground up into a paste. For instance, across the top row, you can see that we made 6 composites of kokanee from Angle Lake, and that each composite was made up of 3 fish put together. Across the bottom, you can see that we had 6 composites of shiner perch from Lincoln Park, and each composite was made up of between 4 to 5 fish. Now, there were a few special cases where we analyzed single fish, and in those cases, we kind of parted them out. This was because we were also interested in exploring differences in contamination between the fillets and the carcass samples taken from the same fish. So for instance, here we took 6 rainbow trout from Angle Lake, they were rather large fish, and made separate fillet and carcass samples from each of those fish. We also analyzed the fillet and carcass from a single large brown bullhead that they took from Lake Meridian. So I'm going to show you results of the rainbow trout data next. These are the contaminant results for those rainbow trout fillet and carcass samples. The carcass values are shown in dark orange and the fillets are in light orange. And as expected, concentrations were consistently higher in the carcass compared to the fillets. Across the bottom, the first 2 on the left are the PCB concentrations expressed both as aerochlors and total PCBs or homologs. Then we have the PBDEs next, DDTs, chlorines, and PFAS. Differences in concentration between carcasses and fillets ranged from about 45 to 85%. And we saw similar results for the Lake Meridian brown bullhead, though I'm not showing that data here. So we think this information is particularly relevant to the communities interviewed for the Fisher survey, because as we just saw, almost 2/3 of the fishers reported eating the whole body of their catch. We think this information highlights the need to expand the fish parts evaluated when developing fish consumption recommendations or advisories, especially for these traditionally underserved communities. So fish consumption advisories are generally calculated off fillet concentrations in fish. So now let's look at some of the results from the composite samples, those groups of fish put together, whole bodies. The dots on this graph represent the concentrations of total PCBs in each of the composite samples of shiner perch from Seacrest Park on the left and Lincoln Park on the right. Those are both marine locations, so these are marine perch. These fish had the highest PCB concentrations of all the fish we analyzed for this study. To determine whether we should make fish consumption recommendations based on these results, we compared the concentration levels to screening levels established by Washington State Department of Health for issuing fish and shellfish consumption advisories. So Department of Health has both average fish consumer screening levels, which is shown here in a red dotted line, and then high fish consumer screening levels, which is shown in this blue line. So because high consumers in the blue line eat more fish, the screening level used for them is typically lower than it is for the average fish consumers. But as you can see in either case, the PCB concentration in shiner perch from both locations is well above both of those consumer screening levels. And so, as a result of this finding, on our flyer, we recommended people limit eating shiner perch from Lincoln Park and Seacrest Park to no more than 2 meals per month maximum. And so this is the sort of backside of the flyer for the seafood or the marine species. But we also have recommendations for other species on this flyer. When we put it together, we decided it would be helpful to the fishers to include data on other marine species that we collect for our long-term tissue monitoring program. So species we collect outside of this particular project. Those fish are English sole and then also Dungeness crab and red rock crab. We had enough data for these species to make recommendations at 6 other locations, including Quartermaster Harbor, Alki Beach, Redondo Beach, Tramp Harbor, 2 locations in Elliott Bay and Shilshole Bay. Notice also at the bottom of the flyer that we've explicitly stated not to eat crab guts. This recommendation is based on our crab monitoring data, which shows much higher concentrations of contaminants in the crab's guts. They call it crab butter. Sometimes it's the hepatopancreas of the crab. So it's much higher in that tissue compared to the meat of crabs. And our findings here are consistent with data that's been gathered by the Washington State Department of Fish and Wildlife. And Department of Health already has a Puget Sound-wide advisory against eating crab guts for this reason. So we really wanted to highlight that. So now let's move on to some of the freshwater fish data. The dots in this graph represent the concentrations of total PCBs in samples of 3 kinds of fish taken from Angle Lake. It's kokanee there on the left. The center 3 are rainbow trout samples, both a single fish carcass that we took of a whole carcass and then a fillet and whole body samples. And then let's see, rock bass on the far right. So here we're showing the concentrations, as I said, in composite and fillet samples. So happily, we found that the rainbow trout from Angle Lake had some of the lowest PCB measured in the fish caught for this study. And I'm not showing the data here, but they also had the lowest concentrations of PBDEs, the flame retardants, PFAS, and chlordanes. Unfortunately, the kokanee from Angle Lake had PCB levels above the Department of Health's average consumer screening levels. And so, as a result, we recommended limiting consumption of kokanee from Angle Lake to no more than 4 meals per month maximum. We made 2 other recommendations based on fish caught from this study. Those were for yellow perch from Lake Desire and also yellow perch from Lake Meridian. The yellow perch from Lake Desire were much less contaminated than those taken from Lake Meridian. So you'll see that the number of yellow perch meals recommended from Lake Desire is higher than those at Lake Meridian because those fish are less contaminated. Again, we also have recommendations for other species on this flyer. Those are based on fish data we've collected in the Green River, Lake Sammamish, Lake Union, and the Cedar River as part of our long-term fish contaminant monitoring program. So as on the other side, also at the bottom here, we've highlighted that it is better to eat only the fillet or meat of the fish compared to the carcass, because we saw from our fillet to carcass comparison that the fillet generally has less contamination. And I can say that this is also a general fish consumption recommendation made by the Washington State Department of Health on their website as well. So this is consistent information. And we also included on the flyer on both sides some information about some of the chemical contaminants in fish that tend to be higher in Washington State and be the cause of some of these recommendations and advisories, and that's specifically PCBs, what they are and how they're harmful. And then we included some information about what is a meal size, because all of our recommendations are based on meals per month. And so you can see at the bottom left there, we have the size of a meal or one uncooked fillet, both for an adult and for a child. So we've tried to provide as much information as we could about that as well. So what are we going to do next? Well, we plan to use the information from this study to change our long-term fish monitoring program. we want to provide contaminant data about more fish from more locations to better serve your communities and other communities in King County. This map shows the locations where we currently monitor for fish and crab in the King County area. And you can see there's a number of marine locations and a number of freshwater locations, including some rivers and lakes. We plan to start monitoring new fishes at some of the sites that we currently monitor, and those include shiner perch and kokanee that are shown there on the left. In addition, we plan to add some new fishing locations to our program. These will likely include smaller lakes in South King County, like Lake Meridian, Lake Desire, and Angle Lake. They're kind of hard to see on this map. They're pretty little on the satellite view, but I've got them circled there. And we also plan to add some new saltwater locations along the Puget Sound shoreline south of Alki that we're not monitoring yet. And in fact, we've already begun sampling and testing for shiner perch at some of these new marine sites. So last summer, we surveyed for shiner perch using beach shade nets at Alki Beach Park, Lincoln Park, Des Moines Beach Park, and the Dash Point State Park. And those fish are being analyzed in our lab. They're nearly finished, and we look forward to seeing the results and reporting on those later. So I want to take a moment to thank the many people that are listed here who helped make this project a success. That includes the Refugee Federation Service Center staff, their many partners, and the many community fishers who helped out. We also wanted to thank the King County Environmental Lab for the tissue analysis and processing, and the Washington Department of Health, especially Emerson Christie, and the Public Health Seattle King County, who helped us on the project. We consulted with them extensively on the fish recommendations that we made. Department of Health looked over all of our data and gave us the thumbs up for the recommendations, so we feel really good about the work that we did there. And so that's pretty much it for today. I want to thank you for your attention. I have here a link to the flyer in all the different languages we have prepared so far, and then we have a final report that's available as well for this project. And so if you want those, they're available. We can maybe copy them and paste them into the chat, or however we want to do that. So at this point, I think we could take any questions.
Thank you so much. So for the audience, we will be sharing in an email those links. So if you have them now, we'll share them out in an email that goes to everyone. Thank you both so much. It's so neat to hear about this connection between scientists and community and addressing questions that matter to the community and in ways that represent them and their needs and their interests. So I really, really am thankful that you two were able to come and present this for us.
Absolutely.
Yeah, there's a lot of questions coming in, and then my brain is spinning with questions, and then I've got some on a kind of separate space to think about. A couple of maybe just really kind of clarifying types of questions to start with. One was related to the what constituted a meal, and you showed that in the lower left-hand corner with the two palms and
I could go back to that slide too.
Fish. Specific question was what constituted a meal for crabs, but and for the Dungeness crabs. So maybe you could address that. But also, I'm wondering where those sizes came from. Were they from the survey, and did it represent what the fisher people were actually eating, or the communities were actually eating, or was it a standard amount?
Yeah, so it was definitely a standard amount. It's basically the same fillet size that the Washington State Department of Health uses for their advisory. So we use the same, basically created the same graphic that they have on their website for that. And that's I think it's a 6 ounce. I can't remember exactly the number of ounces. I can look that up, but basically, yeah. And we also tried to represent it on our flyer using this hand graphic that we think is really useful to sort of as a quick field guide to the size of a meal. And for crab tissue, I think it's basically about the same, sort of the same amount that you would use for crab tissue or crab meat as well. And then we, explicitly make that recommendation to stay away from the crab hepatopancreas or the center. So we really tried in these flyers to make pictorial and graphical representations to be able to communicate this information to people, even people who might not be able to read or can't read in the particular language. It's one of the reasons that we also use this green face, yellow face, red face to try to communicate in other other ways, what would be considered safer and less safe and things to avoid eating. So yeah.
I'm curious about how, I know you work closely with Department of Health on this. So maybe there's two directions I want to go with this question. One is, I'm pretty sure it's the Department of Health. They have recommendations for how to prepare fish, for example, to reduce contaminant exposure. And I'm wondering if you all, I don't see it in your flyer. And so I'm wondering if that information is being conveyed to the people you worked with and how that's happening. And then I'm also curious, you know, is Department of Health excited that you're doing this? Or, I mean, like, where are they, how are they going to use this information? Like, how does this kind of connect back to them ultimately?
Yeah, that's a great question. So I'm going to answer the first part of the question and maybe pump over the second part to Janae. I can say that we really struggled when we were making this flyer to make sure that it was providing enough information to help the fishers, like in the field when they're out fishing, or to make some decisions, but not overcrowd it with so much information that it was sort of too much and not useful. So in terms of preparing, how to prepare their catch, we didn't include that on the flyer because we felt it was more important to communicate information about which species are safer to eat based on the meals per month, which parts of the tissues to avoid, and then providing some more information like these links that we have. As you see on the lower left, the lower right-hand corner, we have links to the Department of Health's fish consumption advisories as QR code, and then also a link to the Washington Department of Fish and Wildlife for their fishing licenses and costs. So we wanted to provide that kind, a link to that information so that they maybe could go to the DOH website, which has much more information about, those kinds of things, how to prepare fish, better to cook it. And then, so that's kind of how we handled that. And like I said, we consulted with DOH, we consulted with Public Health Seattle King County, who's produced flyers similar to this before. And we also consulted with the Refugee Federation Service Center. They saw drafts of this to sort of make sure that we were providing enough information, but not overdoing it and making it too complicated or too, burdensome to read. As far as Department of Health and how whether or not they're going to use the data and how they felt about it, Janae, do you want to talk about that one a little bit?
Yeah, sure. Yeah, we worked closely with Department of Health. They knew we were doing this project and that we would want to be communicating results back. And, we kind of had to see what the results turned out to be before we understood, was there a lot of contamination we needed to worry about or not? But yeah, they were interested and excited about the data, and they were totally happy to work with us when we asked them how we could best communicate the risks and the recommendations to this particular community. And so, normally they will issue a fish consumption advisory that's for the general public. And it's assuming the lower consumption rate. They wouldn't use the high consumer rate for that. And it would apply to more of a generalized community. So in this case, they said, we can, when we want to communicate risks to special populations, if we have very specific information for them. And so they were happy to work with us so that we could do most of the work to, because they have one person who serves the whole state. And we could do most of the work to get that math done and determine what the recommendations were. And then he could review and approve it. And approve our messaging. And so part of our negotiation was we were not allowed to call this an advisory. It's not officially an advisory.
It's a recommendation.
But yeah, we didn't realize before this project that they do issue or communicate very targeted messages to communities when there's data available and there's maybe either higher or special risks to those communities. So they do plan to use the data. They said it will take a while. So that was, one reason we negotiated to do something now. But they do plan to use the data and incorporate it with the rest of the data that they have for these water bodies and then determine their formal fish advisory advice from that.
That's awesome.
And I just have one other thing I want to add too. The data that we got on the Shiner perch from this study was pretty new information. I don't think anybody had really tested Shiner perch from some of these marine areas for contaminants before. And I think we were a little surprised to see the level of contamination in this sort of small little forage fish. And the information that we got from the Fisher survey indicated that they are eating marine perch as well. Shiner perch, likely pile perch, other perch species are eaten, and they're likely eaten whole. It seems that they like to, deep fry or fry these fish and consume them whole. So that was, I think, really useful and new information that we got out of this project. And DOH was really interested in receiving all of our data, but they were especially interested in that Shiner perch data. And so we really felt strongly about, gosh, we have this new information. It seems like these contaminants are kind of higher than we expected them to be. We felt really strongly that we needed to communicate this back to the fishers. And so it was really interesting and cool to work with Department of Health and Public Health Seattle King County to figure out how to best message that and do it in a way that was appropriate for our team, Yeah.
Yeah. So, I mean, that kind of relates to a question I was going to ask later, but I'll ask it now. And that, and maybe just to build what you just said and then segue into my question. We kind of walk into these kind of situations and we have some rules of thumb around where we would expect higher levels of contamination or not. So fish that are higher trophic level, older fish, larger fish. And so those kind of rules of thumb, it sounds like are something that
don't always work.
Yeah.
Although I guess Shiner perch are pretty fatty little fish.
Okay.
Pretty high levels of lipids. So
yeah. So it's complicated, right? As we try to
Mhm.
predict. So that's where these measurements become super important because
exactly.
we're
Yeah.
beyond
Data.
They're like reality checks.
right.
Yeah, absolutely.
Yeah.
Well, what other surprises did you find, or were there other things that you were surprised about in any part of this? The data, the interaction.
Yeah. I think the kokanee concentrations were a little bit of a surprise as well. And I think, didn't Richard say that the kokanee are stocked at the lake? Yeah. So
they're stocked at a younger age than most of the fish that are stocked. And so they have a longer period of time to accumulate contaminants.
Eating at the lake, yeah.
Yeah. And so we actually plan to follow up with DFW about that because they probably don't realize that's happening.
Right.
That's super interesting because that could lead to a change in how they're stocked. Yeah, which then could change.
That's right.
That's super cool.
Yeah, so we definitely plan to continue looking into kokanee and talking with DFW about it.
Okay.
Yeah, so that was interesting. And then we were really excited too on this one to sort of highlight to the fishers where might be safer places to go fishing for fish that they're interested in, because that was really one of the things that they wanted to know from the study. Like, can you tell us what are the better choices? We don't always hear about what are the things you can eat and what are the things to avoid. Like, tell us what are the things that are safer to go after. And so we were really happy for the yellow perch to be able to say, okay, if you want to go after yellow perch, better to go to Lake Desire. If you're going to go to Lake Meridian, eat less of them, and so we really wanted to be able to try to do that, and at different lakes, give or rivers, give them some kind of an indication of which species are safer to go after, because they're definitely very interested in going fishing, and they do it with their families, and it's so we're happy to do that.
I need to go to the other people's questions, but
oh sure.
but not my own. But it would be so fascinating to see if over time, people start moving to different lakes, and then it becomes harder to fish there. So then there's people who go back to the ones where it's easier, where it's more. That would be really kind of interesting to study. And
yeah, absolutely.
Behavior changes with this information.
Mm-hmm.
Are there opportunities for follow-up for that, like long-term, how behaviors change as a result of this information?
We don't have anything specific in mind yet. I mean, we definitely track long-term trends of fish, and shellfish over time.
Yeah.
But in terms of tracking behavior, we don't have anything in the works yet. Janae, do you want to talk about that?
Yeah, we as I mentioned in the intro, this was like a first type of project for us, and we are planning to continue to track the chemical burden in these fish, but we're actually trying to look at how we can connect with more community members, because while we reached a lot of different communities with this project, it was very focused on refugee and immigrant communities. So there's certainly other communities out there that could benefit, and that we want to understand and connect with. So we don't have any plans, as Jennifer said, to track behavior, but as we dive more into this community engagement, it's probably something we're going to be thinking about.
Yeah.
How do we develop a performance metric?
Yeah.
To track it.
Okay, I love that idea. Okay. Related to something one of you just said, there is a question comparing data from the past. Are these fish getting more healthy or cleaner? And I know you have the long term. I know some of this fish you don't have long-term trends for, but you do have some long-term monitoring, and so probably could speak to trends in general. What would you say about that?
Yeah, Jen, do you have anything, or do you want me to just start?
Yeah, if you want to jump in,
Okay.
I know that we do have some long-term data on some of the marine species, a little bit more data.
Right.
Yeah. So
yeah, it does vary by chemical, and we have seen declines in PBDEs on the marine side, and it could be happening on the freshwater side. We just don't have as much data yet because on the freshwater side it's a little more complicated. We have so many different water bodies that it's hard to get data every 2-3 years on every water body. But PBDEs is kind of one of the bright sides. Other things are staying the same, like PCBs. There might be small improvement there, but it's been kind of stagnant. I think if you look longer than our monitoring program, so we have done some coring work in Lake Washington, and if you look at the sediment signal, there's definitely been improvement in PCBs, right over the decades. But we just started this in 2014, so it's kind of hard to detect that significant trend. And then we have other problems that are newer, like PFAS. And so we're seeing new advisories being issued on PFAS. And of course, as we learn more about these emerging chemicals and start to measure them, there's that risk that we're going to see kind of bad news on that side. But we have seen species that are safe to eat. And so we did some sampling of squid in Puget Sound, and we had data that were about 2 decades apart, and that showed that squid are still very safe to eat, relatively clean.
That's a very popular species for fishers. Squid jigging is really popular in Puget Sound. Night fishing squid with jigs.
Yeah, they migrate around the sound in the winter. It's a popular specialized fishing.
Right. Yeah. Okay. I guess kind of related to this, and I think you have answered it, but I'd like to clarify, confirm, and I do have a related question. The question is, are the freshwater fish on the flyer pretty representative of the species people are eating? And kind of related to that, how did you all choose which fish what species they were going to catch, or did they just catch what they caught and brought it to you, and that was it? Like, how did that work?
Yeah,
so we had target fish species that we were looking for from the lakes that we sent them to. So and I have some data about that. I do have some sort of bonus slides that I have in my back pocket to show. So here is a slide that shows in green the places that we already monitor as part of our long-term program. And this is based on the Fisher survey, and it shows the count of fishers that responded that they fish at these different locations. So clearly the most popular fishing locations are freshwater are Lake Washington and Lake Sammamish, and we already monitor those locations. But Green Lake, Lake Meridian, Angle Lake, and Lake Desire were all, kind of higher up on the list as well. And so since part of this project was to look at new species and new locations, we asked them to target freshwater fishing at those lakes. And we asked them to target yellow perch and either catfish or brown bullhead as species to target in those locations. And that's because we know that yellow perch are popular and catfish and bullhead can be popular as well. And they potentially have very different sort of exposure scenarios. The yellow perch is more pelagic or like in the water column, and the bullhead and the catfish are sort of more bottom fish. So we wanted to be able to see if we could make some comparisons at those lakes. But we also told them, it's fishing. You're going to get what you're going to get. You can target fish with certain, sizes of hooks and bait, but we told them if it's a legal fish, according to Department of Fish and Wildlife, you have a license and it's a legal fish to keep, bring it back to us, and if we get enough of them, then we'll analyze it. And so that's how we ended up with kokanee, rainbow trout, rock bat. We were able to make a rock bass sample, things like that. Okay. In terms of saltwater, we sent them also to Des Moines, Dash Point Park, Lincoln Park, and then we had them also fishing at Alki and Elliott Bay, because in this case, we wanted them to target the shiner perch. Even though we'd already been sampling at some of those locations for things like English sole and crab, we had no shiner perch or no perch data at all, really any perch we asked them to get, but shiner perch was really what they got. So because the survey, and I'm just going to show this really quick, I didn't show these, but these are some of the species that were reported as caught by the fishers in the fisher survey. So for freshwater, you can see that catfish, bass, and perch and yellow perch are all very popular species. That's why we sort of focus on the catfish and the perch. In the marine area, you can see that there was people indicated perch a lot. They didn't really say what kind of perch, so we have this unspecified, but other people were talking about pile perch and shiner perch and striped perch. So we thought, since we don't have any data on those species and clearly they are popular, we should maybe take a look at them. Then you also see flatfish are popular, herring also. So those are some species that DFW has some data on and that we also had some data on. So that's why we focused on perch in the marine areas. And then I have this other slide looking at some of the anadromous fish, rainbow trout, very popular, all kinds of salmon that a lot of people didn't specify the kind of salmon they go after, but others did. So you can see that clearly trout and salmon are very popular. And then we also got some data on shellfish, which I'd really like to follow up on in future studies. We focused on fish here, but I think there's potentially a study to look at shellfish contaminants and maybe get some more specific data about where people are going shellfishing, because we didn't link locations to the species caught in the survey. It was kind of a problem with the survey. It'd be nice if we did it again to ask them what fish they're getting from specific locations, and the same with the shellfish. It would be really nice to have that information.
Okay. Mm-hmm. So what was on the figure that you all created was informed by the survey, but then you used like kind of
some of our other data.
Yeah.
Right. Because the survey, we did get some good fish from the survey, but sometimes it wasn't enough fish to allow us to make a recommendation, because you have to have a certain number of samples available to actually make a recommendation. And sometimes we fell below those marks. So the flyer that we made would have been really, lacking in numbers of fish if we just used the data from this pilot study. So we added the fish from our long-term program to just include more information.
Oh, okay.
Mm-hmm.
And I see that Janae's answering some of the questions. I appreciate that, Janae.
Check.
I guess I'm kind of curious, one of the concerns, we're almost out of time. There's so many good questions. There's a lot of accolades on here. People are really happy and like excited about this work. Maybe I'll go towards the idea of the crab butter.
Oh yeah. Hepatopancreas.
Yeah. Do you think, so I guess we have a question. One attendee asked advice for Canadian fishers and researchers, as our Department of Fisheries and Oceans currently states that contamination only affects hepatopancreas and crab. Your work shows otherwise. So that's one side of the question. The other side is, one of our guest says, but that's the really good part of
And
the
it's a
crab. So,
delicacy.
yeah, and so are you seeing that, and this goes back to the behavioral changes, but in the meeting, did you hear anything from your
Yes.
attendees about
Yeah.
that?
Absolutely.
Actually,
Yeah, Janae,
it was very interesting because I think, one of the things that surprised me at the workshop was that the people were so engaged on this.
Mhm.
They brought their family, they brought their kids,
Kids there, yeah.
just so they could hear what was being said. And they were also, most of these people are, not all of them, but a lot of these people are actually representatives already of their community. And so Saporn, who was the lead contact at Refugee Federation, she knew all of these community representatives, and then they kind of extend the invitation from there. But we really encouraged them to communicate outward themselves, because we were only going to reach the people at that workshop, and they had much more connection to the rest of their communities. So we were really encouraging them to do that. And Saporn at the meeting, she at the end said, we love crab butter. Like, she's telling everybody in the room, like, we love crab butter, and we have to remind each other, like, when I'm over at your house, if I see you, serving up the crab butter, I'm going to tell you, like, hey, don't do that.
Do that. They said we need to model that behavior and do it ourselves at our, when we have dinners or when we have parties, or, but yeah, they were really concerned about that. And they were like, really, it's bad? And we said, yeah, it's pretty contaminated. I know it's a delicacy, but if you want to avoid contamination, it's really much better not to eat that part. And so that's why we were so explicit about it on the flyer. But it's difficult because it's part of the culture. It's a delicacy, but it truly is much more contaminated than the meat. I mean, a hepatopancreas is like the liver and the pancreas organ in shellfish and crabs. It's the organ that processes all of the contaminants and retains a lot of them. So it's no bueno, no good.
Yeah, and it's an interesting example of risk versus benefit, and we all make our choices. Like, is there more benefit to eating it or not? And that's an individual decision. But
yeah, of course.
Yeah,
we can only make recommendations.
Yeah, I appreciate you two being on here, and that this work. This is super neat, and we had a lot of engagement with the questions, and so thank everyone else for being here today. In closing today, I wanted to give special thanks to all of our government scientists who work on our behalf, and we appreciate all that you do. And you two representing some of our government scientists at the state level or county level, I guess.
County.
I just want to thank you and thank everybody for the work that you all do.
Thank you
very much. We're happy
It's
to
great
be
to be here. Yeah, thank you.
Bye.
Bye-bye.